first of all, it's funny, like some of the current administration priorities, it's always interesting the things that are like deemed to be political or not political, right? Like, administration priority right now in terms of equitable healthcare. Like, I don't know anybody that's in the healthcare system that thinks the healthcare system today is evenly distributed. It doesn't matter. Like that is like, that's an American priority, right? And by the way, it was my favorite thing that I liked on CMMI. I never felt political pressure one way or the other. Like, your job there is to drive better patient care at lower cost. That's not Republican. That's not Democrat. That's American. And so I think if I could think about things going forward and how to improve things, I think there's a nice base from an outcomes-based care model. I think that CMMI did what it should do on the models. I had somebody call me and say, "Oh, direct contracting, like, are you upset that they took that and now I was like, what do you mean am I upset? Like, it's not called Adam Boehler contracting, first of all. Number two, like, what an administration should do if they're thinking about their job in terms of improving results is take whatever is prior and not scrap it because prior, but build on it, which, by the way, is exactly what happened. And I think improved. And so if you ask me what I hope is, when Patrick Conway ran CMMI, there was a lot of learning that went on, right? And so we learned what works in a model, what doesn't. And then what we try to do is refine, build kind of a common chassis. And what I hope for them from a CMMI perspective is that they continue to refine, make it better, and introduce their own things. I would say one thing I would like to see happen, I hope there's action and bipartisan action on the drug side at some point. And it's interesting, again, to be clear, pharmaceutical innovation and what pharmaceutical companies, they've saved massive amounts of lives. Some of these therapies coming out are unbelievable, right? So I'm a fan. I'm not a fan of like other developed countries paying more but something needs to be reconciled there. And I actually think the pharma issue is less an issue of like pharma making crazy profits all the time. Their EBITDA margins aren't crazy. The problem is how much the United States EBITDA margin is versus other countries. So I just hope, I hope we can make meaningful progress. Maybe we won't. There isn't a great history there, honestly, of us making meaningful progress, but things change. And there was a not great history in other industries, and then there became history of bipartisan progress. So, one thing I will say from a government perspective is I retain hope and believe always, because I saw it, that good policy can win, that it can and does win sometimes, not all the time.